Welcome to Medicine Handy Point. Today we will discuss history taken from a patient presenting with a joint pain. So for the first thing which we'll do is to rule out septic arthritis. So if we will ask if the patient has acute onset of joint pain with fever involving just one joint, it points towards mostly septic arthritis because that is orthopedic emergency. Next step is then we will ask about the onset, which is very important. Certain onset uh, is usually infection, gout, trauma, while onset over the weeks is rheumatoid arthritis, osteoarthritis, or pseudo gout. So onset will give us the clue what kind of disease we are dealing with. Then duration. If the duration is less than 6 weeks, it could be a viral. If it is more than 6 weeks, then it could be rheumatoid arthritis. So once we have asked about onset and duration, then we will follow with which joints are involved. We will we'll count the number of the joints involved. Then we will ask whether the involvement is symmetrical or asymmetrical, mean one side is involved, the other side is not involved. We'll ask the fleeting nature of the involvement, which means that if the patient is having pain in the hand joints one day and the next day the patient is having pain in the knee joints, means that is called a fleeting involvement of the joints, which is actually characteristic of some of the diseases like joint involvement in rheumatic fever has a fleeting kind of a involvement of the joints. And then we will ask about the involvement of ligament and joint. We'll ask about pain in the area where the joints are inserted, or we will ask whether the muscles surrounding the joints are painful or not. So once we have asked about onset and duration, we will follow with number of the joints involved, symmetrical, asymmetrical involvement, fleeting joints involvement, and involvement of the ligaments and the muscle surrounding the joints. So now, roughly, rheumatoid arthritis usually have symmetrical involvement of small joints of the hand and feet, mostly metacarpophalangeal and interphalangeal joints are mostly involved, but it may also involve knee, shoulder, and cervical spine. Osteoarthritis is usually asymmetrical involvement of the hand, knee, hip, and spine. Distal interphalangeal joint and metacarpophalangeal joint at the base of the thumb are involved in the hand. So, in rheumatoid arthritis, there was no involvement of distal interphalangeal joint, while osteoarthritis has involvement of distal interphalangeal joint. Then gout. Gout usually affect the first metatarsophalangeal joint, but it can involve the knee joint as well. Gout can affect knee and shoulders as well. Seronegative arthritis, it has four diseases. One is ankylosing spondylitis, psoriatic arthritis, it has reactive arthritis, and enteropathic arthritis, means inflammatory bowel disease related arthritis. Usually there is symmetrical involvement of large joints and the spine. These they involve usually the large joint and the spine. They are usually associated with enthesitis. Enthesitis is the tendon insertion near the joints. So the patient will be having pain over there, or there will be inflammation of the ligament and tendons around the joint. Then we'll ask about the characteristic of the pain. Joint pain is usually constant localized pain to the particular joint, which is worsened with the movement. A morning pain is suggestive of inflammation, while gradually worsening pain throughout the day is usually degenerative problem of the joint. Then we will ask about the joint swelling. try to differentiate the swelling from effusion. Effusion usually localized and large, and from bone deformities like Harbenden, Heberden nodes, which are formed in the osteoarthritis in the distal interphalangeal joint. So try to differentiate it from that. Then we will ask about the stiffness. Morning stiffness more than 1 hour is likely inflammatory, while stiffness less than 1 hour is in osteoarthritis, or stiffness after some period of inactivity. It is usually associated with osteoarthritis, and this is called gelling. Gelling. Gelling means when there is stiffness which occurs after a period of inactivity. Then we will ask about rash. Rash and joint involvement occurs in psoriasis, SLE, and infections like rheumatic fever. They have erythema marginatum. So joint involvement and rash carries importance. Lyme disease also has a rash and joint involvement, and any viral exanthemus can have joint pains and rash. Then we will ask about orogenital ulcer, which will point towards SLE and Behçet's disease. Eye symptoms, episcleritis and scleritis are feature of rheumatoid arthritis, while dry eyes are feature of uh, Sjogren syndrome. So ask about that. Recent infections like enteritis and urethritis, if they are there in the history of the patient, then reactive arthritis, which usually involve large joints of the lower limb. Also ask about back pain, which may points towards the ankylosing spondylitis. Then we will ask about the functional status of the patient. This is very important. We'll ask whether the patient can use washroom, can change his or her clothes, can button or unbutton the clothes, and can calm. So because this has this social, this point toward the social impact of the disease. Family history, will ask about psoriasis and rheumatoid arthritis because they run in family. Social history will ask about occupation, because if the patient is a manual worker picking up heavy stuff, so osteoarthritis will be in differential accommodation facilities and modification for the patient level of disability. So we'll get an idea about the joint disease. I hope you liked the video, and please subscribe to the channel.